Now, shock isn't just a single disease, it is actually what we call a final common pathway. That means many different potentially lethal events can ultimately lead to it. We are talking about massive blood loss, severe physical trauma, a heart attack, or even an overwhelming infection. Any of these can trigger this exact state. Today, we are going to explore exactly how the entire body system fails, step by step. Let's start with a core question. What actually happens to the human body when the very system designed to sustain life suddenly starves it? Think about it. The circulatory system is basically a giant delivery network. It brings vital oxygen and nutrients to every single cell in your body. But when this delivery stops, the body starves. Survival is immediately threatened. We really need to understand exactly how this starvation cascade begins.
At its core, shock is defined as systemic circulatory failure. This means the body's blood pumping system is failing everywhere, all at once. This systemic failure impairs tissue perfusion. Perfusion is simply the flow of blood into the tissues, and without this continuous flow, tissues experience cellular hypoxia. Hypoxia just means a severe lack of oxygen. Without it, the cells literally cannot meet their basic metabolic demands to stay alive. This usually happens because the heart is pumping less blood or there is simply less blood available in the vessels.
So, when vital oxygenated blood stops flowing, the cells face an immediate crisis. But cells are resilient, they must survive. So they actually change how they make energy. They transition away from normal aerobic respiration, which relies on oxygen. Instead, they switch to anaerobic glycolysis, which doesn't use oxygen at all. This hypoxic or low oxygen state buys them a temporary burst of energy. But this survival trick comes with a very severe cost. Making energy without oxygen creates waste. It rapidly produces a dangerous byproduct called lactic acid. Now, this lactic acid accumulates very quickly. The inside of the cell becomes highly acidic. In medicine, we call this metabolic acidosis. An acid is incredibly toxic to the cell. It directly impairs normal cellular functions. Crucially, it also destroys vasomotor control. Vasomotor control is simply the ability of your blood vessels to tightly squeeze or widen as needed. Because the vessels lose this control, they can no longer push blood forward. This means blood flow to the tissues gets even worse. A really dangerous downward spiral is now locked in. This kind of systemic failure can actually start in 5 distinct ways. First, cardiogenic shock. This happens when the heart muscle itself is damaged and just cannot pump. Second, we have hypovolemic shock. This occurs when the body loses a massive amount of blood or fluid, leaving the pump essentially empty. Third is septic shock, which is triggered by a massive, uncontrolled immune response to a severe infection. Fourth, neurogenic shock happens when a spinal injury cuts the nerve signals that tell blood vessels to squeeze, causing them to suddenly widen. And finally, anaphylactic shock. This is a severe allergic reaction that also causes the blood vessels to widen dangerously. Let's look a bit closer at septic shock. It has a highly complex beginning. It starts when bits of bacteria interact with our immune cells. They basically touch specific alarms on the immune cells called toll-like receptors. When these alarms ring, the immune system panics. It releases a massive wave of chemical messengers called cytokines. We call this a cytokine storm. Extremely high levels of specific chemicals, like tumor necrosis factor, flood the bloodstream. This storm then activates the lining of the blood vessels and triggers a whole series of defensive chain reactions. Here is where the damage really starts. These inflammatory chemicals begin to destroy the body's own infrastructure. Normally, blood vessels are lined with tightly packed cells, but the cytokine storm loosens the tight connections between these cells. The blood vessels begin to leak all over the body. Fluid escapes the vessels and pools right into the surrounding tissues, causing severe swelling or edema. This swelling creates a physical wall, meaning nutrients can no longer reach the cells. At the very same time, chemical signals force the muscle around the blood vessels to relax. The vessels widen completely. This causes a massive, dangerous drop in blood pressure. And the disaster continues. Sepsis actually forces the lining of the blood vessels to become highly prone to clotting. We refer to this as a prothrombotic state. The body suddenly produces more clotting factors. At the same time, it just stops making natural blood thinners. This dangerous shift leads to a condition called disseminated intravascular coagulation. That simply means blood clots are forming absolutely everywhere inside the vessels. Millions of tiny blood clots block the smallest capillaries. Blood flow is now physically blocked. That tissue starvation we talked about, it gets critically worse. Next, a severe metabolic crisis unfolds. The overwhelming stress of sepsis forces the body to dump massive amounts of glucose, or sugar, right into the blood. But at the exact same time, it stops releasing insulin, which the cells desperately need to absorb that sugar. This leaves the cells starving, even though the blood is literally full of sugar. This crisis completely exhausts the adrenal glands, which then fail to produce essential stress hormones. Combined with low blood pressure, tiny blood clots, and damage to the cell's energy factories, called the mitochondria, the result is catastrophic. Major organs like the kidneys, liver, lungs, and heart begin to systematically fail. Now, it is important to note that shock is rarely instant. Unless the initial injury is immediately fatal, shock evolves over time. It progresses through a very specific timeline of systemic collapse. We generally track this in 3 distinct stages. First, there's the initial non-progressive stage. Second is the progressive stage. And finally, the irreversible stage. Each stage represents a much deeper, more dangerous level of biological failure. Let's start with the first stage, the initial non-progressive stage. You can think of this as the body's triage response. Reflexes immediately activate to save the most vital organs. Sensors in the neck detect the dropping blood pressure. In response, the body releases stress hormones like adrenaline. It also activates a highly complex chemical chain called the renin-angiotensin-aldosterone axis. All of these alarms do 2 vital things. They make the heart beat much, much faster, and they intensely squeeze the blood vessels in the arms and legs. The body is forcibly redirecting blood away from the skin. It is essentially hoarding blood to keep the pressure high enough so the heart and the brain can survive. But eventually, those early defenses start to fail. The condition enters the progressive stage. Oxygen starvation is now widespread across the entire body. The cells are forced to produce massive amounts of lactic acid just to survive, and the severe acid buildup is incredibly toxic. The acid physically forces the tiny blood vessels to relax and dilate even though they desperately need to be squeezing. Blood literally stops flowing back to the heart. It begins to pool aggressively in the smallest vessels. Because the blood is just stuck in the tissues, the heart has nothing left to pump. Cardiac output plummets, and the blood vessels themselves begin to sustain permanent injury. The final stage is the irreversible stage. At this point, the physical structures of the cells actually begin to break apart. Inside every cell are lysosomes. You can think of them like tiny cellular stomachs. Well, in this stage, those lysosomes rupture. They leak highly destructive digestive enzymes right inside the cells, essentially destroying them from within. The heart muscle becomes too damaged to contract. It completely loses its ability to pump. The walls of the intestines lose blood flow and die. This terrifyingly allows toxic bacteria from the gut to flood directly into the dead bloodstream. The absolute outcome here is complete organ failure and, ultimately, death. In this final irreversible stage, medical intervention can actually create a rather tragic illusion. Doctors might use powerful medicines to artificially correct the blood pressure on a monitor, but stabilizing that number cannot reverse the structural death of the cells. Toxic acid and leaking enzymes have already destroyed the organs from the inside out. The cell's energy factories, the mitochondria, are completely dead. Pumping fluid or pressure into a fundamentally broken system simply doesn't fix the broken cells.
Survival at this stage is impossible, regardless of how much blood volume you try to restore.
We can actually physically see the damage that shock leaves behind. These physical or morphological changes are all driven by that profound lack of oxygen. Up in the upper body, the brain suffers from ischemic encephalopathy. That simply means brain damage caused by a lack of blood flow. The heart sustains coagulative necrosis, meaning the heart muscle cells physically die and turn into rigid scar tissue. The lungs can sometimes survive simple blood loss, but in cases of severe infection or trauma, the lungs suffer diffuse alveolar damage. The tiny air sacs in the lungs are completely destroyed. We call this shock lung, and it stops the patient from being able to breathe.
Moving to the lower body, the kidneys take a massive hit. Tiny blood clots, called fibrin thrombi, get trapped in the microscopic filters of the kidneys. This causes the kidney tissue to die rapidly. The adrenal glands, which sit right on top of the kidneys, run completely out of the stored fats they need to make stress hormones. They are completely depleted. Finally, the gastrointestinal tract, or the gut, loses its entire blood supply. This causes widespread bleeding and severe tissue death all along the stomach and intestines.
Because the root causes of shock are so different, patients will actually look very different when they arrive at the hospital. A patient suffering from massive blood loss or heart failure will absolutely have low blood pressure and a weak, fast pulse. But because their body is aggressively squeezing blood vessels to save the brain, their skin will feel very cool, clammy, and often look blue. In stark contrast, a patient in the early stages of septic shock will also have low blood pressure, but their skin will feel warm and look flushed. This is because that massive inflammatory storm forces their peripheral blood vessels to open wide, pushing warm blood right to the skin's surface. As any form of shock worsens, however, those clinical signs begin to merge together. Because the kidneys are failing, patients develop oliguria. This is a highly critical state where urine output severely drops or stops entirely. As the kidneys shut down, toxic acids and fatal imbalances of electrolytes, like potassium, rapidly build up in the blood. Ultimately, a patient's chance of survival depends entirely on what caused the shock in the first place. Young, healthy patients with simple blood loss have a high survival rate if they are treated rapidly. But septic and cardiogenic shock have very, very poor outcomes. This is simply because they cause such complex, widespread destruction to the blood vessels and the heart itself.